Tetanus. Etiopathogenesis. Tetanus is a serious disorder with a high mortality even with treatment. The disease is caused by Clostridium tetani, an aerobic spore-forming bacillus with terminal spore which has a drumstick-like appearance. Possible routes of infection are umbilical cord in neonates, which is seen in communities that practice cow dung application on the umbilical stump. Secondly, wound. As a complication of road traffic accidents, where aerobic organisms reduce the oxygen tension in the wound, therefore facilitates the growth of anaerobic Clostridium tetani. Minor injuries with rusted nails, piercing of the earlobes, tattooing, injections, etc. Endogenous infections after septic abortion or surgical operation of the gastrointestinal tract. Tetanus due to infection acquired in the operation theatre. Therefore, the saying that no wound, no tetanus is true. Having entered the wound, the organisms multiply and produce powerful exotoxins which produce the disease. Thus, the organisms by themselves do not produce the disease. The toxins produced are tetanospasmin and tetanolysin, which has affinity towards nervous tissues. It reaches the central nervous system. The toxin gets fixed to the motor cells of the anterior horn cells, and the toxin is fixed to the motor end plate, and it acts by inhibiting the release of cholinesterase, causes reflex muscle contractions at the spinal level. The toxin is fixed to the nervous tissue and cannot be neutralized. Favorable conditions for the development of tetanus includes foreign body, injury, devitalized tissues, anaerobic conditions, improper sterilization, and no immunization. The second one is local tetanus. In this, contraction of the muscles occur in the neighborhood of the wound. The third one is cephalic tetanus. It occurs over the wound of the head and the face. Cranial nerves, that is the facial nerve, and the oculomotor nerve can get paralyzed. It has poor prognosis. The fourth one is bulbar tetanus. Muscles of deglutition and respiration are involved. It is fatal. The fifth one is latent tetanus. It develops after few months to years following a wound which might have been forgotten. Sixth one is puerperal tetanus. It occurs as a complication of abortion or puerperal sepsis. The seventh one is otitis tetanus. It occurs due to suppurative otitis media. Here, the wound is a tear in the tympanic membrane. It can occur in any age group, but commonly in children and young adults. The eighth one is post-operative tetanus. It occurs due to improper sterilization of instruments and carries 100% mortality rate. Clinical features. Under autonomic dysfunction, there is increase in the basal sympathetic tone, which results in tachycardia, bowel and bladder dysfunction, labile hypertension, pyrexia, which is fever, pallor, sweating, cyanosis of the digits. Parasympathetic dysfunction results in bradycardia, low central venous pressure, and cardiac arrest. Other features include pneumonia and urinary tract infections. Treatment for tetanus. General management includes admission and isolation in a quiet room, wound care which includes pus drainage, excision of the necrotic tissue, foreign body removal, and proper dressing. Injection tetanus toxoid 0.5 ml to be given intramuscular. Anti-tetanus serum ATS should be given only after giving a test dose. Human anti-tetanus globulin is better and safe than anti-tetanus serum. No test dose is required and it does not cause anaphylaxis. Injection crystalline penicillin 10 lakh units every 6 hours. Metronidazole 500 mg intravenously 8 hourly for 10 days. Causes of death includes aspiration of pharyngeal contents into the lungs, resulting in aspiration pneumonia, laryngeal spasm and respiratory arrest, resulting in cardiac arrest, autonomic disturbances resulting in cardiac arrhythmias. Prophylactic measures include tetanus neonatorum can be prevented by immunizing the mother with 2 tetanus toxoid injections, half ml given in the third trimester of pregnancy. Infants and children are immunized with tetanus toxoid, diphtheria, and pertussis vaccine, which is the DPT vaccine, 3 doses at 6, 10, and 14 weeks of age. This is called the triple antigen. A booster dose is given at 18 months and at 5 years. Immunized individuals who receive a provocative injury is administered a booster dose if he has not been given in the previous 5 years. Tetanus can be prevented by giving tetanus antitoxin in the following situations: wounds of head and face, penetrating wounds, wounds with contused and devitalized tissues, war wounds, and road traffic accidents. In such patients, a dose of 250 units of human anti-tetanus globulin will give adequate protection. Gas gangrene. Gas gangrene is a highly fatal spreading infection caused by clostridial organisms which results in myonecrosis. Other names for gas gangrene are Clostridial myositis, Clostridial myonecrosis, infective gangrene of the muscles. Etiology of gas gangrene. Clostridium perfringens is the most common organism in 60% cases. Other organisms include Clostridium septicum, Clostridium edematans, and Clostridium histolyticum. Source of infection includes manure soil, cultivated soil, normal intestines. Risk group: lower limb amputations performed for ischemic gangrene of the limb, infection from patient's own bowel organisms. High velocity gunshot wounds with perforation of hollow viscus are also associated with risk of developing gas gangrene. Pathogenesis. Gas gangrene develops in wounds where there is heavy contamination with soil or foreign body. This is commonly seen following road traffic accidents. Endogenous infection from patients' fecal matter may result in gas gangrene or contamination of surgical wound. Once entered the wound, Clostridia multiply and produce powerful toxins. All these factors contribute to create a low oxygen tension, hence, clostridial organisms multiply and produce toxins which cause further tissue damage. Once the toxins start acting, inflammation, edema, muscle necrosis, and gangrene of the muscles occur. Clinical features include septicemia, renal failure, peripheral circulatory failure, and death. Foaming liver is wherein gas is produced in the liver as a part of septicemia. Prophylactic measures. The following principles should be followed to prevent gas gangrene. The first one is debridement. Dead necrotic tissue, bone pieces, foreign material are removed. Pus is evacuated. Wound is thoroughly irrigated with antiseptic agents. So remember, when in doubt, do not suture the wound. Secondly, prophylactic antibiotics. Penicillin is the drug of choice. Crystalline penicillin, 10 to 20 lakh units, 4 to 6 hourly, is given for a period of 7 days. Judicious and minimal use of tourniquet, gentle and effective application of plaster cast. Diagnosis: examining the pus under microscope after staining with the Giemsa stain. These organisms are gram-positive spore-bearing. Treatment includes emergency surgery, which includes excision of all the dead muscles and necrotic tissues by using generous long incisions, penicillin to be continued, blood transfusion before, during, and after the surgery, polyvalent anti-gas gangrene serum. Hyperbaric oxygen reduces the amount of toxin produced by the organisms. Do not hesitate to amputate if it is life saving, because this is the only possible measure in late cases. Types of gas infections. The first one is Clostridial cellulitis. Here, healthy muscle is not involved. It involves necrotic tissue and produces features of cellulitis, for example, TENS, swollen parts with palpable crepitus. However, it is a mild infection which can be managed by antibiotics without surgery. Second is a local type of gas infection. It refers to infection confined to a single muscle. Thirdly, we have a group type of gas infection, which refers to infection confined to one group of muscles in the compartment. Such cases get benefit after a compartmental excision. And the fourth one is a massive type. Gas gangrene involving the entire limb needs to be treated by amputation.